we are live now, so please start.
Good evening to all, and welcoming you to the lecture series on stigma and student mental health. So, I am Dr. Thaddeus Alfonso. I'm a mental health professional with 17 years of experience in the field of mental health. I've been into teaching, practicing and consulting and training mental health professionals and related field. I've been associated with many organizations, so including Wellbework and International Institute of Psychotherapy. I am the founding member of Wellbework and the International Institute of Psychotherapy. And before this, I have been with the Institute of Neurological Sciences, VHS Hospital, and I have consulted with UN organizations, a couple of them, and I am also a founder member of Academy for Public Health, which works in closely with WHO and the Union for the Structured Operational Research as well. Formerly, I've worked with a couple of corporates, including Tata Consultancy Services and HCL Technologies. So, and I've been a practicing psychotherapist who has been providing psychotherapy to people in need of emotional and psychotherapeutic services. So with this little background, I like to start my presentation. Before I start the presentation, I would like to say that I have today is the World Mental Health Day, and the theme of the World Mental Health Day today is that greater investment and greater access. Okay, so with that note, I would like to deliver this lecture on stigma and student mental health. And when you talk about stigma, before talking about stigma and mental health, I want to just ask, hi, how are you doing? So we all tend to say that, no, hope all is well, I am saying. So you may say that I am fine, or you say that I'm good, so far so good, all is well. Either of these answers you would give. But however, when we talk about mental health, okay, there's a lot of apprehensions among people and among students, among faculty and among general public, where there is a lot of stigma attached to mental health. As soon as you say that, there is a program in mental health, there is an institute which is providing mental health services. So the stigma is a powerful force in preventing university students from gaining access to appropriate mental health support today. So it is stigma is everywhere, related with a lot of issues, but it is also associated with mental health because it is socially a constructed mark of disapproval. It could be a shame or a disgrace that causes significant disadvantage through the curtailment of opportunities. Because when it is associated with, stigma is associated with mental health, I think people really think twice before even accessing the service, even though they are in need of the service. So most students on a campus or anywhere else, even out of campus, most students prefer not to disclose their mental health problems to anyone, either at the university or at home or with their, or not to share, disclose to their friends as well. Many students take considerable efforts now and then to hide their mental health condition, and in doing so, they really find it difficult to meet the university requirements, and their productivity is jeopardized on a daily basis. How does this result? How is it stigma associated with mental illness? Stigma is a result of misconceptions about mental health and mental illness. So many people have a lot of misconceptions associated with mental health and mental illness. So starting from even mental health and mental illness, people really consider mental illness as mental health and mental health as mental illness. Recently, there is a media analysis of films and print have identified three major concepts related with stigma. People with mental illness are homicidal maniacs who need to be feared. So people started thinking that people, those who have got mental illness or mental health difficulties, are dangerous and we need to really get scared of them. Okay. And the second one analysis, what has come out is that they have childlike perceptions of the world that should be marveled. So, and the third one is that they are responsible for their illness because they have weak character. So, a lot of negativity is associated with mental health and mental illness. So, that is where the stigma has been stemming out of it. So, stigma associated with mental illness, there is a typo. I'm sorry for that. Those who are seeing the PPT. So, fear and exclusion is one of the very fundamental factor that is really perpetuating the stigma among people. So persons with a severe mental illness should be feared and therefore be kept out of most communities. People are still associating mental health and mental illness with asylums that have existed before several decades. So still because of the movie, probably the media, or the way the society has been conceiving it, probably still they think that these people should be kept out or away from us in asylums or away from the communities. The second concept is that problem is that authoritarianism. So people think persons with a severe mental illness are irresponsible. So life decisions should be made by others because we need to ascertain our authority over people with mental health issues. And yet another group believes that there is benevolence to be shown. Because persons with a severe mental illness are childlike and need to be cared for. So they need care. So we need to be always providing the care to them. So self-determination, independence is out of question. Having said that, there are two types of stigma that could really stem into any individual for that matter, whether you have a problem or you do not have a problem, you are having a diagnosed mental illness or mental health issue, or you don't have anything that you presume that you have it or you have been diagnosed to have it. Nevertheless, the stigma, there are two types of stigmas we can majorly call it. One is the self-stigma. So students and persons with mental illness, or they may think that the people with mental health difficulties are less capable, or even in general, the students and general public can think that people with mental health issues are less capable and less valued because of their disorder. But it's a self-stigma is where, though I feel anxious and I feel depressed at times, I think going to a psychiatrist or a mental health professional or a counselor or psychotherapist is something, there is a taboo attached to it. People will think that I am incapable if I am going and accessing a professional service. So that way, there is a self-stigma, self-perceived stigma that is there with people. We would have internalized such stigmas. We live in a society that endorses such form of stigmatizing ideas. So when societies endorse those stigmatizing ideas, we tend to internalize that over a period of time and it is being reflected in our life. So self-stigma is nothing but the prejudice that people with mental illness turn against themselves. Okay, with that we think, no, if I am going to get an access to a professional care or a support, that means I am less capable or incapable of doing anything. So I need to fight it out till the end. So that means the person is really perceiving self-stigma. Another one is the social stigma or the public stigma, we call it. The public stigma is the reaction that the general population has to people with mental illness. There are certain situations where stigmatizing attitudes are not limited to mental illness, but the public seems to disapprove persons with psychiatric disabilities significantly more than the persons with a physical illness. Because the physical illness, we tend to embrace it and say that, and we tend to empathize and sympathize with them, saying that, okay, and we are able to realize that there is visible problem, there is an injury, there is an ailment, and I'm able to see it. There is a physical issue. I have diabetes mellitus, or I have a heart disease, or I have an injury that I met with an accident. The public seems to approve that. But when it comes to psychiatric disabilities or psychiatric conditions, there is less approval from people. So from the society, that is a social stigma, which is attached to mental health issues. So both public and self-stigma may be understood in terms of three components. Over a period of time, an individual can develop a lot of stereotypes, and that can lead to prejudice and discrimination. This could be primarily due to the fear of discrimination for students during their college years and in professional employment. For example, a student having issues in concentrating the studies and has lost sleep over the last 1 week or 2 weeks or over a month, but still they may think that, no, I can do this. They may try very hard to address that, thinking that they are capable of doing, or they can only do this, and if I go and meet a professional, people will look down upon me, or people will come to know that I'm accessing services, and they may try to really discriminate me. So these are the fears many students on a campus can have for not accessing professional services at the right time, appropriate services at the right time. So if you ask me what is stereotype, for example, if I take a public stigma, because you may, as I shown you in the previous slide, that as I told you just now, there may be stereotype, there may be prejudice, and can lead to discrimination. So the negative belief about a group of people, because thinking that the public seems to think that people with mental health issues are dangerous or incompetent, they are weak people. So that is a stereotype we develop. That's a belief there, out there in the air. So the prejudice is that when it comes to prejudice, that agreement with that belief, there is a negative emotional reaction to that. So people with certain issues of mental health issues, we may probably express our expressed emotions, including maybe anger or the fear or the hostility, or sometimes we have a critical comment. We make certain comments on them. Sometimes we really over-involve ourselves with them, thinking that they are incapable of doing anything independently and they are in need of that help with their benevolence. And this could lead to discrimination. Discrimination is nothing but the behavior response to the prejudice that we have. For example, we try to avoid or withhold or not to provide the adequate support to people with mental health needs or mental health difficulties. Those who are in need of mental health care support, or those who are in need of adequate buffers or social buffers for them, we may really try to avoid doing that. So that becomes a discrimination. So stigma can be understood at these levels, at the stereotype, prejudice, and discrimination level. But when I say about that, we need to understand that though there is stigma, there is prejudice, maybe stereotype and prejudice and discrimination because of the stigma. But the global data shows that the statistics tell that statistics really give us the information that globally, mental and substance abuse disorders are very common because almost 1 in 7 people have one or more mental or substance use disorders reported to have. If that is the statistics is all about. Given this statistics, don't we think that it's important for us to address mental health at this juncture, if not before, at least now? So though a stigma is attached, though the prejudice is attached, people are reporting their mental health issues because they are in need of professional support. Another issue that when we talk about stigma that we keep in mind, that we need to keep in mind is that mental health and mental illness. When we talk about mental health, it is nothing but a state of well-being in which an individual realizes his or her own abilities and they could cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her or their community. That is not equivalent to mental illness. So when we talk about mental disorders comprise a broad range of problems with different symptoms. However, they are generally categorized by a couple of combination of abnormal thoughts or emotions, behavior, and relationship with others. So when I say that I feel depressed, I feel anxious, that doesn't mean that you are having a mental disorder. Unless and until it is clinically diagnosed that you have a mental disorder, nobody can say that there is a mental disorder, or you may realize that. So unless you go to a mental health professional to get diagnosed, so until then you may not realize that you have an illness. So that is why mental health is nothing but when there is a stress, when you are not able to cope with the normal stresses of life or demands of life, probably you may get into issues eventually, if not today or tomorrow, if you're not addressing at that level. So those disturbances can lead to distress and they can lead to disorders. So there is a possibility. Because stigma is there, we tend to really postpone accessing mental health care services. So that can really the problem can become chronic when there is a lot more delay, and the prognosis is going to be very, very poor, because if you go very late, a mental health professional, very late in the process of illness, and it would have become a little more chronic, and their intervention has to go for much more longer than required to really give you that kind of a relief, or that kind of to enhance your coping skills with that problem. So what kind of an impact the stigma can have on an individual, on a student? Some of the harmful effects, as I told you, one thing just before now, if stigma can include the reluctance to seek help or treatment. So the people may not really access the services, though they are in need of it. So that is why most of the time, now you know that the statistics that every other few seconds there is a suicide in this world. So if they are able to really, there is a way that they think that there is no stigma existing, and it is just like any other health condition. So can I just really access the service? We can avoid a lot more suicides. Correct? One of the reasons I could say that is not the only reason, only factor which can stop suicide, but I'm saying that is one of the reasons. So the harmful effect is that there is the reluctance will creep into one and all, that will really jeopardize our ability to seek help, or our volition to our interest to seek help or treatment at the right time. And another harmful effect of stigma can be lack of understanding by family, friends, or peers, or my classmates, or co-workers, or others. So there is a possibility that my friends can really burlesque or mock at me, saying that this guy is always sulking, he has all the issues, he is obsessive, or he has depression, whatever name that we are familiar with, we tend to speak around that. So this lack of understanding can really affect people with mental health issues where they may not even seek help. Okay, they may not even look out for professional support when they are in dire needs. And the fewer opportunities for school, social activities, or work. So when a person with a history of any mental disorders, probably mild or moderate or severe mental disorders, or a neurosis or psychosis, whatever it could be. So people, because of the stigma, we think that we cannot really provide this support in our education institution or in our workplace or all that, or in our social gatherings or in family or in a peer setting. And yet another effect could be bullying and physical violence or harassment. There is a possibility that people can make critical comments on people with certain mental disorders, and there could be they can get subjected to some kind of bullying or physical violence or any part of harassment, any form of harassment. I'm sorry, any form of harassment. It could be from the significant family members or from anybody in the society or from friends or known or the unknown ones. Another effect is that though our physical ailments or most of the health insurance agencies cover our physical ailments, but the health insurance that does not adequately cover mental illness treatment. So the mental health issues are maybe time consuming because it is related with the mind and the thought process, the cognition and the emotion and the behavior of an individual. It may take time, a lot more time to get better. So they have to follow, treatment regimen, which may be much more longer than in some of the physical ailments. So there is no health insurance that covers it, maybe because of the stigma that is attached with mental health. So, and yet another belief is that you will never succeed or that you can't improve your situation. So, if a person with mental health issues are there, they really stamp it that they come to the belief, a strong belief that they would never succeed or they cannot improve, even if we are going to provide any support. So it is better not to really look into that. So that is another effect of a harmful effect of stigma, which is associated with mental health. So having said that, there are stigma, so personal and social stigma, as well as there are harmful effects of the stigma related with mental health. How do we address this stigma? How do we really access, what is appropriate to us to enhance our mental health and well-being? Okay, the first step to cope with the stigma is the acceptance. Unless and until I accept the condition. So acceptance of the condition is very, very important. That I feel depressed. I have been crying for the past 3 days, not continuously, even if not continuously, episodically. I have had the crying episodes and I am having difficulty in my sleep and my appetite is decreased, loss of appetite or decreased appetite. All that is there. So is it possible for me to accept that, I am feeling this. I am able to see that I am not the same like before. There is something. Can I accept that, okay, there may be some issues. Let me go and address. Let me seek professional help. So acceptance of the condition or the kind of the state of mind that I am into, the mental state I am into, I'm able to accept that. That's the first step, that if you are able to do that, accept it, and you will seek for help, cutting across the stigma or breaking the barriers of the stigma. I want to tell you all that. Acceptance is, nothing is wrong in accepting it, because that health, there is no health without mental health, if you ask me, because health is amalgamated. So mental health is part and parcel of health. So there is no health without mental health, and it is the high time that we realize that it is the basic element that really gives that the energy and the way that we want to live, the motivation to live a life, the purpose in life, and the happiness that you want to enjoy on a daily basis, and the way you want to be productive day on a daily basis. It is all about mental health. So if you think that health is important, then nothing else but mental health is also very much important. It is part and parcel of health. So accepting one's own the mental status, whether it is anxiety or the depression, or whether it is anything that the trauma that probably you're experiencing due to any event or epidemic or pandemic or a disaster, or because of the loss of loved one, whatever it could be, it is better that we accept that. That is going to really help you to access services. As soon as you accept, when you are able to accept, immediately that will really lead you to the get treatment, access the mental health services immediately, because you may be reluctant to admit you need treatment, but maybe because of the stigma that is associated with, maybe because of your past experiences, not so good experiences probably, or maybe because somebody told you that it's better that you address than going to anybody. So it could be any reason for that matter that you may become reluctant to, you may be reluctant to accept treatment or seek help. But I would say that don't let the fear of being labeled with a mental illness prevent you from seeking help. Because it's not about labeling that you have an issue, labeling that you go through the bout of depression, or you go through that phase of phobia, or you go through that obsessive compulsive disorder. It's not about branding. It's about most of mental health professionals nowadays, they are very clear that it is not about branding, but about helping the person with, but only for helping the person with mental health care needs, mental health needs. Only for them to understand that what is the condition you are going through. Probably they want to make a diagnosis so that they provide you the appropriate treatment, not otherwise. So they may need that because they want to know it is just an anxiety, or it is a generalized anxiety disorder, or if this is a depression, clinical depression, or a major depressive disorder, or this is something else, any other mood disorder, or this is a type of a psychosis, or it is something to do with a phobia, whatever it could be, for them to understand that, or it is any other personality disorders. So for them to understand that what exactly is the problem, they may explore they may take a detailed history from you and understand that. You need not to get worried about it because they maintain the confidentiality and they are in this field probably for a long time, and they are qualified mental health professionals, so they know that they need a diagnosis to provide you appropriate treatment, pharmacological as well as non-pharmacological interventions. So because that can provide relief by identifying what is wrong, and these interventions are going to reduce the symptoms, because otherwise it is going to really be perpetually there, and it's going to interfere with your work and personal life, and all walks of life will be really, it is going to interfere with all walks of life. So to reduce those kind of interference in all walks of life, to get you better, I think you need to really break the barriers or cut across it and say that no, it is my turn, it is my health, and I am supposed to get the treatment. That is going to help. And as I told you, accept the condition already, and do not equate yourself with your illness. Always remember, don't ever think that because there is a problem, mental health issues with me, that I am that problem. No. I have even listened to patients calling me and saying that, doctor, I am bipolar. I need actually I need an appointment. So even before saying that, I am so and so, saying the name over the phone and saying I'm bipolar. So this person has been under treatment in another city. After they moved here, they came to know about me and they wanted to fix an appointment. So here, the person is very different from the problem. So it is not that Don't get really worried about that. I'll be really, tagged with the condition that I have. No, you yourself need not to really get carried away with that. So you can say that, okay, I have depression, I have gone through depression, I'm out of this now. That is fair enough. So I cannot say that I am bipolar. I can only say that I have been diagnosed to have it and I am under treatment for that. So there is a lot of difference between your identity and the illness. So don't get carried away that call yourself that I am bipolar, I am schizophrenic, I am an addict. No. So I have probably diagnosed with schizophrenia or I have schizophrenia and I have addiction or I have addiction. So if you're able to do not equate these you and with your illness or yourself with your illness, or if you can really demarcate the boundaries between you are an individual who has got into the stress or life events which is really having an impact on you. That's the only thing. So the more you are equating yourself with the illness, the lesser will be your volition or your interest of accessing the service or approaching the professional to get help. So that's why this stigma, you need to do this to cope with the stigma. And don't let stigma create self-doubt and shame. So stigma does not just come from others. If you think about it, you may mistakenly believe that your condition is a sign of personal weakness. So a parent from a student from a National Institute of Importance has been referred by a professor to me. Then I had to do a thorough assessment of that gentleman, and we realized that he has got a condition that has to be treated pharmacologically and non-pharmacological intervention, that is medication as well as psychotherapeutic interventions are required for this individual. But when he himself did not have the insight, because the condition was a part of psychosis, one of the type of psychosis he was diagnosed to have, and the family was not interested in accepting that. For them it was like a shame. How can we accept that my son has got or my ward has got this condition or my doctor has got this condition? So don't let the stigma, because they were worried that if he comes back home, people will come to know that why he has got into such a wonderful institution, and the future is going to be, very well settled. How come he is back home? Why he is staying here? What happened to the college? Did they really ask him to leave the institution? So they are worried about so much that, but that is not the fact that we need to embrace. The fact is that, okay, he has got a condition, what best that we have to provide, the help that we could provide to him, that is more important. So seeking counseling or educating yourself about your condition and connecting with others who have mental illness can help you gain self-esteem and overcome destructive self-judgment. So unless you accept that and connect with, okay, educate yourself and your family members about the condition and connecting with others who have the same, probably the condition, through support groups or who can help you to gain self-esteem and overcome this self-judgment, destructive judgment, I think it will go a long way for you. So let us not let the stigma create that self-doubt and the shame. Do not perceive it. It is required. That means we are going and accessing it. For students, I would suggest that another step to cope with the stigma is that get help at the institute. If you or your loved one or your friend or you have a mental health issue or a difficulty or an illness, that may affect your learning most of the time and your interactions with people, and find out what plans and programs might help. If that's so, think of where I could get help and what type of help will really help. It will be appropriate for me to seek, and what type of help I can seek and how it is going to help me. So reach out. The first thing is reach out to the institute counselor. Don't really get ashamed of seeking help from a mental health professional, as I told you. It could be a counselor or psychotherapist or psychiatrist to get the professional help on your campus as soon as possible, because it is important and it is a law and it is necessary that all the institutions have mental health professionals on campus to provide these services. So discrimination against students because of mental illness is against the law. We all know that. So talk to professors or administrators about the best approach and resources where available. Or if a faculty finds it difficult to understand a student's mental health issue, it is better he or she or they gain appropriate information from the mental health with the help of the mental health professional. So it is all the more important that for you to access immediate help which is available on campus within the premise, so that your mental health issues are addressed at the earliest. Other things I would say that you could join a support group on campus within a college or a university setting, or outside the college or the university, where the peer group or the support group is available. So you can become part of any regional or national or international groups that offer programs and resources that would in turn help reducing stigma. So in order to reduce the stigma, so you can be part of any group that is providing the educational programs or offer services or programs and the resources, yeah, so that you will become more acquainted with what is it is all about. Is this mental illness is nothing but it's like any other physical ailment, and there is a remedy, there is service, there is help available. There is nothing wrong in accessing for the help and accepting that I have a problem, or in whatever form and in whatever way. Yet another step could be speak out against the stigma. It is important that you consider expressing your opinions at events or in letters to some editors or on the internet. It can help in the pursuit of instilling courage in others facing similar challenges and educate the public about mental illness or mental health and mental disorders. So it is important for you to speak out against the stigma. Otherwise, it is going to be very, very difficult for us to to really reduce the stigma which is prevalent, or to really eradicate completely the stigma from the whole world. It is going to be very difficult unless and until we are going to really speak about mental health and mental illnesses, and we are going to speak against the stigma as well. So it is everyone's duty that we accept people with mental health issues, and we accept that when we face with that issues, that we accept that yes, I have this issue, so let me go and get appropriate help as soon as possible at the earliest. So these are things that you have to keep in mind to cope with stigma, so that you are not really dragged, or you're not chronically ill eventually, and not losing your sanity or not losing your cognitive capital, where you won't be able to really focus on what you're supposed to do. So in the college, then the final thought, before giving the final thought, I would like to say that in the college, when you are there for a course, either it is for a 3-year or 4-year program or a 5-year program, when you are there, so it is quite possible that students can face some issues, some stresses, maybe some demands which that you may be not familiar with, or there is some lack of resources that can really induce certain stress in you, and the stress can become an issue or a mental health problem for you. Don't shun away from it. And so the final thought is that others' judgments almost always stem from a lack of understanding rather than the facts. So it is not necessary that others are going to judge you based on facts. Maybe they are judging you based on the lack of inadequate understanding, or the lack of understanding, or or the myth that is having around the myth of mental illness or the mental health that people have. Based on that, probably they are judging you. So the way forward for you is that to be a productive individual, to be a happy and healthy individual, it is important for you to accept your condition and recognize what you need to do to treat it and seek support as soon as possible and help in the process of educating others, and it can make a big difference, and it is going to make a big difference. So with that note, I am ending my talk, and I thank you for your patient hearing, and it is open for question and answer session now. So you can type your questions. Whoever wants to ask any questions, please type it there in the Excel which is shared, and I'll be happy to take a couple of questions as well within the given time. So someone from Hyderabad, the person has asked, I am getting one repetitive thought in this pandemic, during this pandemic, what to do? So uh, if you're getting a repetitive thought, I am not sure what type of a thought it is, but if you're getting a repetitive thought, I would request that you need to practice certain distraction techniques. Correct. So why a particular thought is coming again and again? Probably because you believe that that particular thought is, or the believe that that is going to happen, or you fear that it is going to happen. Correct. So the anxiety continuously that you harbor within yourself, probably it is repeatedly making you to think about it, probably. So if you are able to give you some distraction techniques, okay, to begin with, it would be of great help, because I do not know exactly what is the particular thought, or the gravity of the thought, or the intensity of that particular thought. So how grave it is or how intense it is, I'm not sure, because the question is very generic. But nevertheless, it is important for you to practice some distraction techniques. So I would suggest that couple of distraction techniques are there. As soon as probably the thought is coming to you, there is thought blocking techniques. It is only an SOS. It is not the answer for your problem. But after trying this SOS, if you think it is not really fading away or going away from you, it is better to seek some help from a professional. But nevertheless, this particular thing is that you can do something called, distraction techniques called counting down immediately, closing your eyes, or closing the fingers of both your hands, sorry, the palm, right? Close the fingers of your palm and feel the pressure on both your hands and hold the breath to begin with, to hold the breath for 5 seconds and let it out. But the focus should be on breathing, not on the thought. It's a conscious effort you may need to make to do that. Another thing is that if the thought is coming, yet another one you can do is to distract that thought. Just start counting in a descending order from 10 to 0 backward with a gap of 5 seconds. Only think about the image of the numbers. It need not be audible outside if you are in the midst of somewhere. It could be within your mind so that it can. Or listen to your music, call a friend. So these are the distractions. Or just go there, take a sip of water, drink water, and keep the bottle away. So certain these kind of distractions, I'm talking about only SOS, could initiate that. You could try doing it to begin with. Yeah, or just environmental modification psychology, we call it, where when you are sitting idle or alone by yourself in your room and this thought is repeatedly coming, please come out of the room, come into hall where other people are there or TV is there. Just turn on it and watch something that you are willing with, that you enjoy, or speak to people those are available there. These are the couple of distractions that you could start doing it to begin with. But if it is not going even after a couple of days or some 7 days or 5 to 6 days, it is better you consult a professional. I hope I answered your question. And the second question is that somebody has asked here is that how to handle if people around you keep demotivating you. Yeah. So to that, somebody from Delhi has asked this question. So uh, I think there is something called, we always talk about something called self-emancipation. If they are demotivating you, is on what context, about what? I think that is a one analysis probably you may need to do it to begin with. So the demotivation could be probably they are demotivating you to, maybe they are thinking that what you are trying to do may not work. Maybe they have tried and tested it. So you can think of, is there anything that you can learn from the previous experiences of the people, those who are trying to tell you something? Otherwise, you need to emancipate. Emancipation is nothing but you need not to get carried away. So the demotivation will creeps into an individual probably when that person accepts whatever the others say as it is, without even rationalizing, without even analyzing that, in touch with the reality, what it is good for me, you can always take it. So it is not necessarily that you have to completely ignore what others say, but what is good in this? Is it going to really help you? If you're able to do that kind of an analysis, then I think you will not get demotivated. You will only get to extract what is good from there and move on to your life. So it is not necessary that you need to accept or get carried away with whatever others say. Please do that rationalization check, rational check. You do it and see that whether this is something which is going to help me, what level, and what more that you could do to prove yourself that you are capable of doing. So you need not get carried away with what they say completely. What is good, always you accept it. So there are so many things to talk about it, but I think there are so many questions coming on the pipeline. So I am just limiting that answer with that. If you don't mind, this person from Delhi. So another question is from Kuala Lumpur, from Malaysia, is that why confused politicians make policies like next exam is valid only up to June 2021? So I'm so sorry because this talk is on mental health. So the confusion is part of probably because of the pandemic that everybody is confused. It is quite possible for people to know. It is quite human to make error, but nevertheless, I think you need not really get anxious about what is going to happen. But today what is that necessary for you to do to keep yourself calmer and happier? It's very, very important because what is in the kitty tomorrow, nobody knows. Nobody can predict what is going to happen tomorrow. Though they are making an announcement which may really give you a lot of, induce anxiety in people. I agree that, I accept that. But nevertheless, can you be prepared to tolerate ambiguity is by accepting that today is more important than yesterday or tomorrow, so that it is important for you to focus on what is now important here and now. Can I do something about this to make myself more comfortable with the state of mind that I have now today, in touch with the reality? I can make myself today, here and now, than too much worrying about what is going to happen tomorrow. I think if you're able to focus on what is today is important and here and now, I think that will really lay the foundation for a better tomorrow for you. So that is what. But this political reasons, I don't have a say on it because you have to excuse me for that. So, so somebody asked, yet another person has from Bhubaneswar asked mental health, but I'm not sure. I'm afraid that there is a question here or a clarification. So that need to see whether what that person wants to really understand. If you want to type it again and tell me what exactly you want to understand about, you want more information about mental health, or what is that question, then I'll be happy to answer that as well. Yet another person from Mysore, Karnataka has asked, being bullied and judged almost entire childhood, it seems to be have remained me in long-term memory. I have tried seeking help from friends close to me, but they have started showing avoidance and it is creating self-doubt and low self-esteem. With the time, I have improved, but it sometimes bothers to a deep extent. How do I overcome this? To this person, my humble request would be, please seek help, because you have mentioned that you have been bullied and judged almost entire childhood. So I suspect that there may be a lot of trauma, as you have mentioned here. So trauma. So it is better that you seek professional help, because they will be able to really gauge the situation, at what level the trauma has impacted you, and at what level, what type of a help they could provide. Because just giving you tips alone may not work, because probably they need to work with you extensively to understand your belief systems, what type of an impact it has made over the period of time, and what are the damages it has created in you. By understanding those impact or the damages, they will be able to suggest you the way out. So this is possible to address. The good news is that you can address this issue systematically and scientifically with the help of, with the help of a mental health professional. So I would request you to suggest somebody. Please do that, and I think the help will be given to you. So, but what I would strongly recommend is, don't get stigmatized, because accessing a service, professional help is always good for your life and for you to get out of this condition. So please do seek help. And next question is that, when do I get to know and what help? When do I get to know that I am depressed, and what help can professional lend in rectifying it? Because most of the time the depression is due to some event of our personal life, maybe relationship, self-ambition, or from others' rude behavior or beliefs. This question is asked from Punjab by an individual. I would like to say that depression is not only due to some personal event, or because of the broken relationship, or because of the benchmark that you have, or others' rude behavior. Not only because of that, it could be biological as well. So it is, you have to, when do I get to understand is that, when you know that you are not the same way that you have been for the past week, or for the past week, or more than that. So when you realize that you are not able to focus or concentrate on certain things, you feel sad most of the time in the day, or you may feel that you are not able to sleep because something is disturbing you, or you feel low about yourself, these are the symptoms with which you can understand that major symptoms, the cardinal symptoms with which you can understand that probably you are depressed. And sometimes maybe the loss of appetite is also another symptom. So these major symptoms, if you are able to identify that you are going through, it is a clue that there is a way that you can address this. There is a need for you to address this. You can access the service. And what kind of a help they can provide is that, as I told you, depends on, after diagnosis of the problem, depends on the condition, they will be able to suggest whether medication is required and how long, and whether psychotherapy is required. Most of the time, if there is a clinical depression, in practice, in popular psychiatric practice, they will be provided, if it is a major depressive disorder, surely is pharmacological or medication, as well as psychotherapeutic interventions, because both equally would, or both are going to complement in the process, and they would recommend that. So I think I would request you to identify these symptoms, whether you are experiencing, and seek help. Both pharmacological and non-pharmacological support they may request you to go through or take or access, because if you're diagnosed to have depression. I hope I have answered your questions. Thank you. And the next person from Bilaspur have asked, sir, how we can manage the college curriculum and extra activities like competitive coding while staying at home, because I feel like lacking to continue both at the same time period. Okay. I hope I understood your question. So managing the college curriculum and extra activities like competitive coding while staying at home. I think it is priorities. You see, most of the stress comes into people when we have difficulty in prioritizing on a daily basis what I need to do first, what I need to do second. Okay, so what is the emergency need? Correct? So think of a traffic police, a traffic signal, for example. As soon as you see the red, before the red comes, the orange comes. As soon as you see the orange, you know that the red is following and you stop there. After the red is done, then you know that the orange is coming, probably the green is going to come, and then I need to proceed. So priorities are very, very important. What is my emergency need on a daily basis now? What is the curriculum that I need to cover today? What is the other extra activities that I need to do? So what is important today and now? I think you need to prioritize. So if you're able to prioritize the list, the laundry list that you have in a day, am I really using the time for me to really have a much more time for anything else other than this? I think maybe you need to work on it. So if you're able to identify how many hours I spend on a daily basis out of the 24 hours for my sleep, for my work, and for my family and friends, or now there's much of no action outside, but nevertheless with the laptop or the handphone, the mobile phone or the laptop or the internet or the TV or whatever. So if you're able to prioritize, that is only will come in when you take a conscious effort to do that mapping. So if you're able to jot down or note down the day that what you do on throughout the day, I think you will be able to understand where there is a mismatch. So then you can really organize your work and will be able to provide some quality time for all this. So you need to prioritize first of all by understanding what exactly you are doing on a daily basis. If you're able to note it down or mark it somewhere, you will understand where the most of the time is going. If you're able to realize that, I think that's the first step for you to really manage your time. So I think that is what you wanted to understand. And another question is from Mumbai. Thank you for that question. It's a wonderful question. Another this from Mumbai is that sometimes I feel so low that I don't feel like doing anything and sit alone. However, this is not every day. Is this sign of depression? I would say that this could be one of the signs of depression. One of the signs of depression, when you feel low, very low, and you are unable to do anything and you feel like sitting all by yourself down. So it may not be every day, but at times it is happening. I strongly believe that it could be one of the symptoms of depression, and you can really discuss with somebody whom you think will be able to give you some kind of an understanding what you are going through. This could be one of the major symptoms of depression as well. Yeah. Thank you. But this need not be only the symptom. It could be part of it. Since you have asked for this question, that I want to explain that this could be that way. Yet another question from Kanpur. Please provide email. So I will query later. I get connectivity recently now. I got connected. Yeah, we can. I think the organizers will be able to share my email ID. I think it wouldn't be a problem if the protocol allows. I think they would be happy to share this email ID, and uh, we can take it from there as well. I think I have completed most of the questions. Is there any more questions? Anybody has got it? I'll be happy to answer. Yes. I'm sorry, I wouldn't have answered no adequately, probably as you have expected, probably because the time constraint and some answers questions needed a lot more elaborative explanation where each step has to be explained. But I'm not sure that is possible at this juncture. But if you all have to, if you all are able to accept that if there is a problem that you will be seeking professional help and support, there is no harm in seeking help from a confidante or a favorite person who is trustworthy. I think nothing like it. I think you can really overcome the stigma and go ahead with it. So I'll be happy to hear that you understood certain things out of this lecture and take home message, and you are able to really practice in your life and able to educate people about there is nothing wrong in having a mental health issues, and it is as quite as similar as any other physical ailment. I think the world is going to become much more beautiful. Thank you. All of you have a wonderful evening. Thank you. If there are no questions, we can close this.